My name is Dr. Chris Burke, and I'm the first Aboriginal person in Australia to qualify as a dentist. I'm a Kamilaroi fella, and I grew up in country Victoria. I now live in Canberra on the lands of the Ngunnawal people. When I graduated in 1982, there was no association to support Aboriginal or Torres Strait Islander people in the dental profession. It was another 20 years before doctors Catherine O'Donoghue, Chris Possingham and myself were able to form the Indigenous Dental Association.
Hello, my name is Gary Watson and I'm a Gurrung, Gungaloo and Beer Recovered man. I'm the previous past president of the Indigenous Dental Association Australia. The Australian Indigenous Dental Association is an association that helps to support the participation of Aboriginal and Torres Strait Islander dental practitioners. Its other priority is to help improve the culturally safe and equitable delivery for oral health to all Aboriginal and Torres Strait Islander people.
I'm Dr. Jess Manuela, a Palawa woman from Lutruwita, a dentist, a dental business owner and a mother of two. I'm one of the directors and co-presidents of the Indigenous Dental Association of Australia. To me, IDA means connection and a chance to work with our mob to improve the face of dentistry. We have the answers.
I'm Jodie Hart. I'm a Minjinbal woman from the Bundjalung Nation. I'm a dentist, practice owner, mother of three, and current co-president of the Indigenous Dental Association. The IDAA advocates for increased representation of Aboriginal and Torres Strait Islander peoples in the dental health workforce and for improving oral health outcomes for mob.
I'm Hannah Grant Nylon. I'm a dentist and a director for the Indigenous Dental Association of Australia. I'm a Bundjalung woman and I live and work on Bundjalung country in northern New South Wales. One of the reasons I wanted to get involved with IDA was to engage with fellow practitioners who share a common goal of enhancing the dental profession for Indigenous practitioners and for patients.
My name is Caleb Rice and I'm studying a Bachelor of Oral Health at Central Queensland University. My mob are the Yimmin people and I have connections to Gurrung in Central Queensland, which is where I'm from. So my experience at the IDA conference in 2024 was incredible. I was able to meet so many like-minded people that are just seeking to improve the health of our mob, and the speakers that were in attendance just had so much knowledge and experience to share, which made it such a powerful event. Not to mention the professional connections that you can make in person, they're just super invaluable. So returning to uni in 2025, I am excited to advocate for Aboriginal health among my peers as one of the few Aboriginal students studying oral health at CQ. So I just want to take that with me onto my first external placement in my final year.
Hi, my name is Kelly. I'm a proud Woromai woman and my mob is from north of Newcastle in the Port Stephens area. I'm also an oral health therapist and a clinical educator and supervisor at the University of Newcastle. I was lucky enough to attend the IDA conference in 2024. The program was jam-packed with a lineup of speakers that were insightful and knowledgeable, and it was truly one of the most inspiring conferences I've ever attended. I feel ready to return back to work at the university. I'm feeling motivated and inspired, and I know that I have the support of my IDA family to achieve all my goals in 2025.
Great initiatives of IDA are the member yarns, where we meet regularly on Zoom to have discussions, to ask questions, to get to know each other. We also have wonderful guest presenters on a wide variety of topics, and it's an invaluable community to be a part of.
IDA gives a voice to Aboriginal and Torres Strait Islander people. In dentistry, we are the peak body for our mob and have a seat at the table with major stakeholders like the Dental Board, the Australasian Council of Dental Schools, the Australian Dental Council and more. We are here to speak up for our mob and make sure our invaluable knowledge is incorporated into the important decisions that affect us. We are also here to speak up and support our dental students when needed.
We'd seen the benefits that our medical colleagues had gained from the Indigenous Doctors Association, and we saw the collegiate benefit, the support for Indigenous students, and the advocacy that they were able to do within the health sector.
Apply for IDAA membership if you are an oral health therapist, general dentist or specialist, dental hygienist or prosthetist, or a student in a registered dental health program who identifies as Aboriginal and/or Torres Strait Islander.
I hope that the Indigenous Dental Association will be able to positively engage with key stakeholders and all dental practitioners to help in closing the gap between Aboriginal and Torres Strait Islander people and mainstream Australia.
My hopes for the Indigenous Dental Association going forwards are that it becomes a strong and vibrant organisation supporting Indigenous students, advocating in the oral health sector, and providing a collegiate framework for Indigenous dentists and dental practitioners to connect.
Plans to expand membership categories are underway. Show your support as an ally by connecting with the IDAA on social media or subscribe to our newsletter.